Hello, I've decided to do one extra video because I told you to go and look up all of the different bacteria that are urease positive or that produce urease, but I decided to go ahead and give this mnemonic right here. So to punch and kiss, okay, so that is going to be all of your bacteria that are going to be urease producing. So remember, if they're urease producing, then that's going to be basic. So your urine is acidic, so if it's going to be in your urinary tract causing a UTI, then these have a high propensity to cause stones, like I talked about before with the Proteus. Remember the three S's. You have the swarming motility, and you have the struvite stones that it can cause, and also they produce sulfur, of course. So you have the Proteus, and you're going to have the ureaplasma. You're going to have Nocardia. Remember that one? All right, because Nocardia is going to be the one that you differentiate it from Actinomyces. Nocardia, asteroides. I said people on steroids, it decreases their immunity. People with decreased immunity are at risk of getting this. Okay, Cryptococcus, we'll talk about that once we get to the fungi and all. You got H. pylori, and so that's going to be your punch, P-U-N-C-H, and then you're going to have Klebsiella, the I is for ignore. You have Strep pneumo and Staph sapro. Okay, so those are going to be your punch and kiss. Those are going to be the ones that are urease producing. All right. Now, people that have sickle cell disease are at risk of getting salmonella to cause osteomyelitis. Now, I just wanted to throw that out there. And then people with chronic granulomatous disease are going to be people that have problems with recurrent catalase positive organisms. And so what about cats? Well, you need places to put them. Okay, so you need places to put your cat. So you have pseudo, listeria, aspergillus, candida, E. coli, Staph aureus, and Serratia. Okay, so places to put your cats. And then now let's talk about just some extras just to throw in here, odd and ends. I don't want to waste your time and don't want to waste mine either. So I'm only going over stuff that I feel we left out that might be good to know. Okay, so let's talk about very briefly Propion bacterium acne. I don't think you'll get a question on that, but it's anaerobic. It's part of your normal skin flora. The worst it can do is cause a brain abscess. If you pop that zit and it's in that little triangle of danger right there, you know, around your philtrum, where your folds are, right there around your top labia, right inferior to your nose, then you know possibly that could go back into your cavernous sinus and the things that traverse through your cavernous sinus, such as your V1 and V2 of your trigeminal nerve, and then you can also get your cranial nerves 3, 4, 6. They're all going to traverse through there. Your cranial nerve 2 will not. It goes through the optic canal, but anyhow, then those are the kind of situations that possibly could cause some problems with that. Leptospirosis, you've got animal urine. That's what's going to transmit that. Q fever, that's going to be your Coxiella. That's what I was saying you get from livestock aerosol or from amniotic fluid. So you got where amniotic fluid or livestock, maybe their urine or something will dry up and you live downwind, downstream from livestock or a farm or something, you could get the Q fever. It is a zoonotic disease and it is going to be self-limited. It's usually an influenza-like sickness. It's gram-negative. Most most people are asymptomatic, but the main presentation clinically that is seen is radiographic findings that's going to be similar to viral pneumonia. You're going to have patchy segmental opacities. It's going to be diffuse interstitial stuff like a reticular pattern. You might have fever, a non-productive cough, pleuritic chest pain. Once again, it's going to be transmitted through livestock, urine, milk, feces, amniotic fluid, those kind of things. The worst it can do is cause valvular heart disease. A lot of times you'll get this when you're handling manure or straw, or people at slaughterhouses will be at risk also. Places where feces or urine would dry and then go out as aerosols. So let's talk about Pasteurella. Pasteurella, as I said, can come from an animal bite, dog or cat typically, and you can get cellulitis or osteomyelitis from that. And then your rickettsias, we talked about rickettsia, I call it Ricky, Rocky Mountain spotted fever down in the southeast United States. Make sure you don't confuse that with the bullseye rash of Borrelia burgdorferi, which is going to be more in the northern U.S. Rickettsia also has a typhi form for endemic typhus, and it has Prowazeki form, which is going to cause endemic typhus as well. And both of these, one's going to come from the louse, which is single form of lice. The other's going to come from flea spreading. The one about the Prowazeki that you'll want to watch is that it'll be a lot of times a kid that'll get a fever and then it'll go away and then it'll come back. It's kind of a recurrent relapsing fever. Sometimes I've seen that as the recurrent form, actually, rickettsia recurrent. So sometimes different sources will say different things, but just be familiar with those. It's not that important to where you're going to fill a test on it anyway. And so let's go over some vectors and then we'll wrap this segment up. So for your Zoody's tick, like I said, XOXO, you love Lyme burgers, Lyme disease, there's your burger in it for Burgdorferi fluoride, okay? Can also cause babesiosis and nucleosis, the granulocytic form. We're going to compare that with the Lone Star tick down here, which is the Americanum tick, and that causes circulosis, but the monocytic form, okay, also known as the dog tick. The Lone Star tick is also known as the dog tick. And so then we'll talk about the D. andersoni now, and that can cause tularemia because Francisella, you get it from rabbit skins, remember? But I said you can also get it from ticks and also from a deer fly. Ricky, you can get that one right here, Andersoni, what I was talking about earlier. And you can also get Colorado tick fever. We'll talk about that once we get into our viruses. And that is it. I just wanted to make sure that I touched on those items and didn't leave you out in the dark with those. As always, I appreciate you coming and watching these videos. And $3 is all I'm asking, a one-time donation of $3 for anyone who's watching these videos and if you're appreciative of them. Thank you so much, and I hope you have a happy studying.